So I do think there are disparities in healthcare and certainly in cancer treatment, maybe even specifically myeloma. One of the problems is that it's not as well known of a cancer and it gets misdiagnosed. So obviously that's part of the reason for Myeloma Action Month in March is to get the word out there and hope other doctors, primary care physicians like the one I saw, are aware of some of the potential symptoms so that it doesn't get misdiagnosed, especially for people with bone involvement and back pain and things like that. I think there are disparities in healthcare in general for people who have health insurance, don't have health insurance. That can make a big issue about seeking treatment and not seeking treatment. And I think that obviously there can be a disparity in a more rural area depending on where you live. I mean, if you're lucky enough to live in Boston and you're near Dana-Farber, or you live in Houston and you're near MD Anderson, those are places that you can seek out treatment and specialists easily. If you're in a more rural area with a local oncologist who's maybe seen one case of myeloma, if any, there's going to be disparity there. Those people are not going to get the same kind of information and treatment as those who are seeking out a specialist or near a center of research where there are myeloma specialists, and specialists meaning that's all they deal with and they see a large number of myeloma patients. So that's why that's one of the things that we all as support group leaders and patients is to emphasize seeing a specialist in addition to your local oncologist. Not saying that your local oncologist isn't good, but if they haven't seen many cases of myeloma, they're not going to be as up on what's the latest treatments, the latest drugs to come out, and whatnot. So that's why we all advise that you see a specialist in addition to your local person. So I think that's where disparities can come. Because obviously there are small rural areas in, every state probably has a small rural area that that's where they live. It's closest to home. They can't get to a specialist. They can't get to a center of influence. And I think that's where the disparities can come. And it happens financially too. I'm lucky enough that my husband finds that important and he budgets that every year for me to go to a seminar, for both of us to go to a seminar. He went with me for the first time, now with the pandemic, I guess it's been 2 years ago, a year and a half. And he enjoyed it so much as a caregiver, got so much out of going to the IMF Patient Family Seminar down in LA. He loved meeting Dr. Dury and Susie, and being with other patients. I mean, we're with other patients in our support group, but a large number from, all over the area with different stories. So I think that the IMF tries to put on as many of those kind of seminars in as many places as they can, which I think helps with disparity because it gives information. And when you're informed, you're a better patient. And I think that helps with what I, in my head, think of as disparity, because it's not just financial disparity. It can be information. Knowledge is power, and what you don't know can hurt you.